Hi, today I'm going to be talking to you about ADHD. Now, I don't have very much time, so please pay attention. What is wrong with you? Are you even trying? Hello? I just told you, how could you forget? Did you forget to take your meds today? Can you at least try and make an effort? Do you even think? I do think, actually. And I really am trying. In 2016, attention deficit and hyperactivity disorder was estimated to affect over 6 million people in America from the ages of 2 to 17.
So ADHD, or attention deficit hyperactivity disorder, is a chemical imbalance of the left frontal lobe of the brain, that part of the brain that's involved with attention and focus, as well as helping control some of the hyperactive impulsive behavior.
Medications such as Ritalin, Vyvanse, and Adderall are used to treat patients with ADHD ages 3 and older. These medications are not depressants for hyperactivity, rather they are stimulants that change the level of dopamine in the brain, a neurotransmitter which is important for attention and focus.
The best analogy I try to use for folks, I think most people understand this, is like if you have a car that has 8 cylinders and only 4 are working well, then the car is still working, but it's not performing to its best ability.
It would be a lie to say that ADHD has never been misdiagnosed before, or that it has never been diagnosed for the wrong reasons. There are many people, and doctors alike, who claim that ADHD is an excuse for children who are bored, or college students who just need the meds to help with an all-nighter. Some even believe it is a social construct, or that it is an aid for the lazy kids to get a leg up in school.
Well, I think a lot of parents, teachers, physicians in the past, not so much currently, feel like it's really a problem with behavior modification, that if you provide better structure for the kids and more strict with them, that will solve some of the problems. However, that doesn't change the fact that there's a chemical imbalance that makes it difficult for them, even in the best of settings, to stay on task and do the work that they need to do. Some people see it as kids kind of purposely doing things to upset their teachers or family or parents, other adults. So I think that it gets misconstrued as being oppositional behavior. They feel like it's being done intentionally, that they're not trying hard enough, that their lack of motivation, which can play a role, but it's usually because they get frustrated and can't do the work that they want to do.
But for the people who really do have it, knowing there's actually something wrong with them can be life-changing. I was diagnosed with ADHD when I was in the 7th grade. I noticed my attention span kept getting shorter and shorter, and I was unable to remember any of what I had learned in class. I started taking Vyvanse when I was in my freshman year of high school. It really helped me to get back on track with my grades and back on track with my attitude towards school. While the medication has helped me a lot, I still have to work hard in and out of school. I decided to talk to some of my fellow classmates who have ADHD about their experience.
When I was 5 years old.
I was diagnosed around in 2nd grade.
At a sports physical in 2014, but it was not severe enough that I needed medication.
For the most part, yes.
Yeah, I get decent grades, I guess.
Yeah, I get good grades.
About an hour.
It depends on how much I have, but on an average night, it takes around 3 hours.
Some days it's really quick, I can really focus in, and then other days, man, it's a struggle because I just get sidetracked.
No.
I usually have to take breaks.
It depends. Again, like I think I'm a pretty creative thinker, so sometimes I get really sidetracked and I walk away from the idea, or I just run out of time kind of going off on a tangent. But I'm usually able, after a couple times sitting down and doing something, to string it all together.
No.
I think so. I have a decent memory.
It's definitely, well, it depends. If it's a standard class, like busy work and like reading and stuff, that can be difficult because it's kind of boring. But if it's a little more abstract and I've got to be engaged to think about it, then I remember those things like the back of my hand.
A lot of times in class, they expect us to read long passages and then remember the information, and that doesn't work for me. I can't just sit down, read, and learn. I have to learn in a completely different way. I'm such a visual learner compared to everyone else, and so I take double the time to learn than them.
Well, I usually get distracted when I do homework. I usually am on my phone when I'm supposed to be working, and I get other kids do that, but for me it's kind of a big issue because usually kids check it for like a minute before going back to work, but I check it for a much longer time, which causes some issues.
I mean, I guess maybe that I'm just a little more like impulsive, maybe a little, my mind wanders more, so you might say I'm more creative in some things. You might also say that I'm easy to distract. I mean, like, I've had people tell me that I'm kind of like a dog, just like bright, shiny object. I get sidetracked. It's just kind of part of who I am. I know how to work with it and use it to my advantage.
I think in general, I think kids with ADHD, they tend to have a lot of, they're very creative. They tend to be engaging. They tend to be outgoing. A lot of times that's what attracts people to be their friends because they're kind of unpredictable, they're impulsive, they say things that can be funny.
Medication is not the only fix for ADHD. It is commonly used for the more serious cases. However, for those less serious cases, there are solutions such as therapy, counseling, and healthy nutrition. Some people even use exercise and athletics as an outlet for their ADHD. ADHD is easily treatable. People are quick to judge kids with this disorder and label them as weird, annoying, or not smart. But just like how diabetics have an insulin deficiency, or how people with thyroid disease have issues with their levels of serotonin, ADHD is a deficiency in the level of dopamine. It should not be given as many negative labels as it has in the past. It's simply a medical problem, and lucky for those who have it, it has a simple solution.